Today.
Hi, Billy Cunningham, the Great American. Of course, the Kentucky Derby, great race. CyberKnife is a big horse going to run in the Kentucky Derby. So I have a missive here from the urology group, that being Dr. Gary Kirsh, about what the group is trying to do in order to assist those Americans who maybe don't have a horse to bet on and do have a horse to bet on. Before we go much further, Dr. Gary Kirsh, welcome again to the Bill Cunningham Show. And what is CyberKnife running tomorrow, and why should Americans be interested in the procedure? First of all, describe the procedure, then we'll talk about the horse.
Well, thanks, Willie, for having me. The procedure is a specific focused type of radiation that we use in prostate cancer treatment. It's very focused and accurate, allowing men to be treated in only a few days as opposed to several weeks with radiation. And we've been using this for some years at the urology group. So we're very excited that there's a horse named CyberKnife in the Derby.
All right. And so is it a long shot, or is it like just a little bit of money you're going to win?
No. Well, my understanding is CyberKnife is in the middle of the pack at 20-1. And the horse was called CyberKnife because the owner had CyberKnife radiation in Florida that cured his prostate cancer, so he's very grateful. I think his 20-1 odds are lower, though, than our chance of curing people with CyberKnife, which is much higher, frankly.
So is CyberKnife is that almost like a miracle that's been developed the last 3 or 4 years? And where do we go from here with CyberKnife?
Well, it's not. I couldn't say it's a miracle. We've had it a bit longer than 3 or 4 years, maybe 5 or 6, but it's a very minimally invasive and accurate treatment for men with prostate cancer that needs treatment. Not everybody does. And when it hasn't, hopefully hasn't spread. And then it's a well-tolerated treatment for prostate cancer that we offer. It's what we call, Bill, hypofractionated, meaning it's a short course as opposed to a long course, much more convenient for patients.
And so how's your urology group getting involved to donate some money to charity if the damn thing wins?
Well, thanks for asking. What we're doing, Bill, is we're betting $1,152 on the horse, CyberKnife. And the reason for that dollar figure is that's the number of patients that we've treated at the urology group with CyberKnife since the horse was born. So for $1 for each one.
And so anyone can make the bet.
Anyone can make. We're making the bet, and if we win, then we'll donate all the proceeds to the cancer support community here locally. And we're just glad that we had a chance to chat, because this is all really about raising awareness for prostate cancer, as you know. And
so if it wins, if CyberKnife wins tomorrow, you could win like $20-some thousand, right?
Yes, sir, and it'll all go to the cancer support community.
Well, another issue arose. Tony Bender popped in and wanted me to talk about something he saw in Tucker Carlson, which is testicle tanning. And I'm not sure. I saw a part of that segment, and I guess Tony Bender thinks it will help with virility. Explain what is testicle tanning.
Well, testicle tanning is pretty much what it sounds like. It's when men decide to tan their privates, Bill.
Their privates.
And I have to tell you, it's not well supported by medical science, frankly. It may look good to certain individuals to have tanned privates, but it does not increase testosterone level. I think this is a falsehood.
So this is not real in the sense that no legitimate urology group or other medical professional would encourage toasting your privates, but nonetheless, when you see it, you want to get the information out not to do it. Is that correct?
That's right. It's I can't say it's harmful, but it's, as long as you don't get a sunburn down there.
Right.
But it's not helpful. Directing light or tanning directly to the testicular area will not increase the output of testosterone into the body. So it is not helpful.
So it doesn't cause more activity within the testicular sac. It doesn't cause more virility. It doesn't encourage you to have more sperm. What it does is, couldn't it cause injury to yourself? It may look good, according to Tony Bender, but will it cause some injury?
Well, I think if you're overzealous, you could end up with a sunburn down there. That would not be a pretty picture, sir. I don't think it's helpful.
It is. In fact, the best evidence is it might be harmful.
It might be harmful. That's right. We don't recommend it. There are many other ways to get your testosterone level assessed. If you have symptoms of low T, like sexual lack of sexual appetite or lack of energy, depression, these can all be symptoms of low testosterone. We can assess that and we can treat it, but not that way.
So that's an old wives' tale that men should avoid at all costs.
I think it's a newer wives' tale. I'm not sure where it came from. It's become a bit of a fad, but it's not something that's backed up by medical science, Bill.
Well, Jerry Lee Lewis talked about great balls of fire. And so this could have serious in fact, could it cause more problems on the other side? Could it hurt you in such a way that it makes it more unlikely that you're going to have a child if you toast your testicles?
Well, I hope you don't toast them that bad. But I don't know that it's more of a skin effect than anything deeper in the scrotum. So I don't know about that. I just know that it's not going to be medically helpful on sperm function or testosterone output, and it could cause skin injury.
That's a problem. And plus, it would be a little embarrassing.
That's a problem.
That's a problem because this one segment was on the media about a guy's playing golf and in a sunny afternoon and exposing themselves, and that's another difficulty. How about this? How about checking with your doctors before you start toasting any part of your body?
Yeah, I think you should check with your physician before you tan your scrotum. Yes, sir.
All right. Now, lastly, CyberKnife is running off tomorrow. The Derby's going to, I think about 6:15, and the urology group's putting up $1,100. If you win, it's all going to go to help those that have these difficulties. And once again, Dr. Gary Kirsh of the urology group, thank you for coming on the Bill Cunningham Show, and we'll do it again. But forewarned is forearmed. Do not do this to your private parts.
Thank you, sir.
Thank you, Dr. Gary Kirsh. Thank you very much. Let's continue with more.